So I'm Kyle Martin. I'm a physician of emergency medicine at Brown University, and then associate director of a fellowship in global emergency medicine. I am honored to be moderating this panel of individuals that we have from Brown University, where we have really started the ball rolling on trying to integrate planetary health into our medical school curriculum. And I wanted to do, we are in the process of trying to connect with other people who are interested in planetary health, and that's what made us interested in coming to the conference. We want to try to make some connections with other institutions and figure out how we can collectively work towards the goal of promoting planetary health in general. So on that note, I will hand it to our panel members to introduce themselves, and then we should get started. And I have some structured questions for each of the panel members, but I do want to make sure that since we have an intimate group, we have this be a little bit more of a conversation so that we're able to talk and learn from each other. So on that note, I will hand it over to Kanika.
Hi everyone, my name is Kanika. I am a third-year medical student at Brown, and I'm also a part of our primary care and population medicine program.
Good morning, everyone. I'm Kate Smith. I'm a Senior Associate Dean of Biology in our Division of Biology and Medicine. I work with all of these students, Dr. Martin and others, to really start bringing planetary health to our campus. So I've been teaching courses and doing research on planetary health since 2008. I'm a disease ecologist by training, so I'm not an MD. I've tried to infiltrate our medical school and bring some lessons from wildlife and pathogens spill over into the work that they do. So really excited to learn from you guys as much as maybe you learn from us.
Hi, my name is Margaret. I'm a second-year medical student at Brown, and yeah, it's been really nice over the past, I guess, year and a half almost that we've been working with Dr. Martin and Dean Smith on just trying to get the medical school to be more conscious of climate change and all the stuff that's happening, and looking forward to working with you guys too.
My name is Julia Santini. I'm also a second-year medical student, working with all these great students and faculty at Brown. And yeah, I'm just really excited to be here. I'd like to echo everything everyone else said.
So just to start out, Kanika, I want to start out with you, and I just want to probe and see the origins of planetary health and what motivated students at Brown to want to integrate planetary health into the curriculum.
Yeah, sure. So actually a lot of the major events that led to planetary health curriculum integration at Brown happened pretty recently. There were a few events prior to 2018, but really in 2018 we had this student-led needs assessment that demonstrated some gaps in planetary health education at Brown. And while that identified some of the shortcomings that we had, I think the major motivator happened in 2020 with Brown's Planetary Health Report Card. And our grade on that report card really caused faculty and students to realize that we have a big need for improved planetary health education. And because of that, we created a task force that had an objective of improving planetary health in general education and otherwise at Brown.
What was it about planetary health in particular that you thought was valuable for our medical students?
Yeah, sure. So as I'm sure all of you know, planetary health and climate change in general are really affecting everyone, and in particular in regards to health, there's a lot of changes that come with that. And I feel like our generation needs to be well equipped to handle the changes that are coming and that we're seeing right now. Our needs assessment showed that a lot of students at our medical school didn't feel well prepared to handle planetary health related outcomes. And I think to improve patient care in general, it was important for us to learn more about this topic.
Cool. Now just a couple questions about the Planetary Health Report Card. Can you tell people, in case they're not familiar, about what the Planetary Health Report Card is and how they might be able to integrate that into evaluating their own curricula?
Yeah, sure. So the Planetary Health Report Card is a student-driven metric-based initiative that is run by an organization called Medical Students for a Sustainable Future. And the goal of this organization is to really improve planetary health education as well as promote sustainable health care within medical schools really across the world. And it does this by evaluating medical schools through the Planetary Health Report Card. And the metrics that are used to evaluate schools, there's 5 of them. We have curriculum, research, community outreach, support for student-led initiatives, and campus sustainability. And so at Brown, we did that report card, and in 2020, we got a B- grade on that report card, and that really encouraged students and faculty to get more involved in creating changes to improve our grade on this report card and show that we are really putting in the time and effort to integrate planetary health into our curriculum.
So B-, I mean, that's not that bad, right? I mean, I think, I mean, what were some of the areas that you found were particularly deficient?
Yeah, so one of the areas that was particularly deficient was the curriculum area. And I think that's where we put in a lot of our effort for change. We found that that was an area where we could work with a lot of faculty and administration to create change within the existing curriculum, and that way it would impact our entire student body. And so we thought that was a good way to get involved. We also, through that have also sort of branched out into research and community engagement, and those are still areas that we are trying to improve on more, but I think curriculum was what really stuck with us and what we really tried to change the most.
I think one of the other things, just to build off of what you said, is that having the Planetary Health Report Card, it's a standardized metric that you can use to compare schools against each other. So I think even though we got a B-, we were able to look at other comparable institutions and say, oh, Harvard got this grade, or Emory got this grade, or UCSF got this grade, and say, we want to be at the same level as these other institutions. So our administrators saw that and thought, and saw that as a need that we had at our medical school, and were willing to devote some sort of commitment towards advancing planetary health for that reason. Kanika, what were some of the challenges that students faced in the beginning of the curriculum integration process? So you did the Planetary Health Report Card. What sort of reception did you get afterwards, and what were some of the challenges?
Yeah, so after we did the Planetary Health Report Card, as I mentioned, a lot of faculty and students were motivated to figure out ways to actually create change. I think one of the major challenges that we faced was that medical school curriculum was very thorough and comprehensive as is. So to create additions to that was difficult. It was hard to get faculty across the board involved in this, and it was hard to even make smaller changes. So we had to work really hard to find nuanced ways to sort of fit these topics in. That was one of the challenges. I think another challenge was that we didn't have as many faculty who had expertise in planetary health education, and obviously that's changing now, as you guys can tell. But we had some difficulty getting support initially. I think also at Brown, there's a centralized sort of hub for planetary health research, or planetary health really in general at Brown or its teaching hospitals. And so it was hard to find and recruit new faculty as well as get connected with other parts of the university like the public health school. So those were challenges, but we've had a lot of time and support over the last few years to really work on these.
And one thing I wanted to just highlight is that it was a largely student-driven process. Why do you think it was important that students were driving the ship in this regard? Do you think that helped the process, or do you think that hindered the process? What do you think?
Yeah, I think it really helped. I think at the end of the day, students know what is best for their education. They're the ones that are going through it. And so having a student-led initiative, primarily student-led, it gave us a lot of freedom and control over our own education. It helped us identify what we wanted to learn and how we wanted to learn it. And once we had that, having the support from faculty helped that sort of come to fruition.
So just to kind of summarize, just in talking about the beginnings of planetary health in the curriculum at Brown's Medical School, the first stages were students who are largely motivated to see this content integrated into the curriculum started using the planetary health report card. And this is available online. You can look up the planetary health report card, and if you want to, you can do it at your own institution. And all of that data is released and is public, so you can compare yourself against other schools. It was great to have it be student-lit, student-driven, and then to have this standardized metric that could be presented to administration. And then from there, we were able to kind of get a seat at the table with administration and the leadership team and be able to figure out what the next steps were in terms of trying to integrate this content into the curriculum. So I'm going to move on now to Dean Smith. Now, same sort of question that I just asked Kanika, but from a faculty perspective. What do you think of this being a student-driven process as a faculty member? And do you think that made a difference as opposed to it being a faculty-driven process? Do you think that helped or strengthened the case for integrating planetary health, or do you think that it weakened the case?
Strengthened all day. I think every institution is different in terms of their culture of how much students drive and how much the faculty, their administration then integrates. But Brown really at every level has long been a community and had a culture where students really do have the agency to do that. And they did in this case. So at the undergraduate level at Brown, we have something called the open curriculum. We don't have general education requirements, and students really are talked about as the architects of their own education. I think that extends to the medical school where it can, as well as our graduate programs. So this was an effort, I see, by a group of students that, it lasted so long and grew so effectively that the administration really couldn't afford not to pay attention. And frankly, I think no matter what type of clinician or educator or scientist you are now, if you're paying attention, you're seeing the effects of planetary health on your work or the patients that you're treating. So I think the students made that clear. There is a national group, maybe the planetary health report card's not national, is it international? It's international.
Yeah, it's international now.
Right,
yeah.
and it's got some gravitas because of that. So, everybody at Brown, no one likes to get a B, right? We can be honest about that. I think the administration paid attention to the fact that that report card existed, that there was something students wanted, that they were seeing in their own practice, that this was something we should really seriously consider trying to integrate throughout the curriculum. So that was a long way of saying, yes, it was important that the students drove this.
With it being a student-driven process, how did faculty come to be involved? And what were some of the challenges and continue to be the challenges with recruiting faculty members to this cause?
Yeah, well, we're not done with that yet, right? I think there are many people that are interested in this topic, and yet we're all experts in our own field. Planetary health is incredibly interdisciplinary, right? So to carve out effort in your clinical life or your research life or your educational life to contribute to something that's not sitting within your specific scholarly field can be a time challenge. I think people in general right now, still post-pandemic, feel like they're really busy. They have more than they've ever had to do for whatever reason, right? We don't know why that is, but they feel that way. So we are still in the process, you, Dr. Martin, and I, and these students and others, in trying to bring faculty into our very student-heavy group right now, which is a good thing, to contribute and bring scholarly expertise so that we can do this curricular integration work. How do we do that? Well, we have a pre-clerkship elective right now for first-year, second-year medical school students, co-led by some of the students in their third years. We try to invite a lot of clinical guests to that elective to meet the students, and I think that's one way in which we can start to build awareness of the work in planetary health and extend invitations to those folks afterwards to be a part of this work. But very much still a work in progress, I think.
Yeah, I think from the clinical side of things, it's hard because in the earth sciences and biology worlds, talking about planetary health and climate change has been something that's been going on for years and years and years. But in the clinical world, we've just suddenly, over the course of the last several years, come to realize how important the influence of a changing planet is on the health of our patients that are presenting. For clinicians, I think, it might not be salient yet. Clinicians might not be as familiar with planetary health topics, and I feel like I don't know if you would agree that it's really been a struggle for us to try to find clinical faculty who are interested or knowledgeable or both when it comes to planetary health.
Yeah, or have the time to do it, right?
Yeah.
So no, I agree. I think, look, right now we have a fantastic group of students and ourselves and another faculty member who are working on the integration. We're starting that now. I think once we start digging in with individual instructors of courses and blocks to create material that we implement, hopefully is a success and of interest and is evaluated well, so we can see that students are getting the knowledge that we hope that they will, that those instructors will start to see the value. And that's one way we'll start to pick up more folks. And so even though we might have individuals very much aligned with this work through their specific scholarly interest or course, and not perhaps as broadly, I think that's still okay because it's so interdisciplinary and broad. We're going to have people kind of contributing in different ways throughout the curriculum.
And kind of on that note, how did faculty and students decide which topics to focus on first or which courses to focus on first when going through the process of curriculum development?
Yeah, so we're doing that now, right? We just kind of accomplished some things there. So we have a pre-clerkship elective. You're working on a clerkship elective for students in residency. So what we aspire to do now at the integration committee is work on modules, if you will, that have depth with brevity, that will sit within every course and every block that's relevant to the topic of that course and block. So we've just gone through an exercise in this committee to think about this year, what are our goals? What are 3 courses specifically that we could work together to create content modules and really set it up in a way with aligned templates and clear learning objectives so that it works beautifully. So I think to choose that, our approach has been kind of twofold, and you guys can weigh in on this. We want to pick low-hanging fruit, right? The courses where instructors already know about this work and they're interested in working with us. We want to pick courses that have topics perhaps that are slightly easier to develop content for example, infectious disease or microbiology. And we want to pick topics that students and faculty want to work on right now to develop this content so that it's fun and people continue doing this work. So I think we've settled on 3 right now. Isn't that right? The infectious disease course,
infectious disease,
pulmonary,
and brain science.
And brain science, right? And so those are also very different from one another. We also have students in the curriculum committee who are in those courses and who've been through them. So I think it was really a mixture of interest on the part of students and faculty, courses students were currently in, and perhaps one that there was enough content now where it wasn't a major stretch. What would be a stretch course? Something about the kidneys. I don't know. I think there are just some courses that lend themselves to this topic a little bit more. Yeah, so that's where we've landed. So, hold us accountable. I think come May, we're aiming to have content for each of those courses ready to go and be implemented in an evaluatable, what's the word I'm looking for? In a way that we can evaluate.
Perfect.
I haven't had enough coffee. In a way we can evaluate through the next academic cycle.
And then just one last question for you in particular, Dean Smith. Have you gotten pushback from other faculty members and administrators? And then if so, how have you managed to navigate that environment of, answering the questions and concerns of other faculty or administrators in the medical school?
Yeah, I wish I could say no and offer you all some specific examples of how to deal with that conflict, but the answer is we haven't. I mean, we have a new dean of our division of biology and medicine. We have a division that includes our medical school and a large program in biology, so we're quite large and diverse. But He is a cardiologist by training, though he's very interested in the topic himself. I think we have a new leadership team, none of which work in these particular fields, but they're seeing it in their clinical practices. They're hearing about it more in their own life. So we happen to have leadership in place now who is genuinely interested in the topic themselves, personally and professionally, but they're also a group of people who are, I think, new and very tuned into the value that students bring when they say, we need and want this thing. And so people are excited to do it. I think, the faculty and students who are leading it now, we need to do the best work that we can this year to bring a body of curricular content and more to the leadership to then say, look at what we've done with so little. Imagine what we could do with more, meaning a budget and perhaps some staff help, so that you don't have a small group of people who are leading the charge on a very limited schedule. Yeah, but so no pushback. Yeah, it's a good thing.
Yeah, we'll see how much we get when we start asking for money.
Right, that's the big question.
So just to kind of catch everyone up, so process started with this Planetary Health Report Card. We took it to administration, and administration said, all right, we're on board with this. Then we created this Planetary Health Curriculum Committee. And the Planetary Health Curriculum Committee, what their task was to figure out really like what are the knowledge goals that we have for medical students. So what are the competencies and how do they align with the medical school's competencies and principles? So after we were able to create those competencies and principles, we then transitioned into the Planetary Health Curriculum Integration Committee. And that's where we're at this point in time, where, like Dean Smith was talking about, we're looking at the individual blocks of the pre-clerkship curriculum and trying to integrate integrate modules into each section. And we're doing that piecemeal, finding the courses where it will work easiest, and then trying to go from there. We're also working on trying to develop a clerkship elective course, which I'm in charge of now, where we're kind of teaming with other universities. So University of Michigan is one place that's done a really good job of establishing a clerkship elective course for students. And it's hard because there isn't necessarily a clinical component to that course. So it needs to be rigorous in a different sort of way so that students are able to, so it meets the academic standards of all the other elective courses. So at this point, we have the Planetary Health Integration Committee. And Margaret, I just wanted to ask, tell me about the membership of the Planetary Health Integration Committee and what are some of the current challenges that the group is facing?
Yeah, so like mentioned previously, the committee is, again, very student-driven. It's led by Dean Smith and Dr. Martin, who are here with us today. And it's some medical students who are of first years, second years, upper years, who all, again, have the same goal of wanting to integrate more planetary health concepts into our curriculum. I think one of the biggest challenges is, like we've mentioned previously, the medical school curriculum is large. There's a plethora of things that we learn. We go through clerkship, pre-clerkship courses, and all of our courses are taught by, each course is probably taught by like 10 different lecturers. So there's just so many different people to work with and different people's lectures that we want to integrate content into. And so I think the way that we are solving that is by trying to make it as easy as possible for these lecturers to access content that would help them integrate this material into their lectures more smoothly and more comprehensively over the course of our curriculum.
How big is the group?
I think we have about 10 students right now, or something like that.
Yeah, I think it's like 10 to 12 students and then 3 faculty members who are involved right now with the group. And we meet on a monthly basis. And just kind of transitioning, when we talk about the medical school curriculum at Brown, we have like 4 sort of pillars that we think about. So we have like clinical, research, education, and then service learning. So talking about research, the field of planetary health has research opportunities. How have you gone about identifying people at the university who are doing research and connecting medical students with those faculty members?
Yeah, so I think for myself, one of the main, I think, things that opened the door for me to doing planetary health research was taking part in the planetary health elective that was offered the first year. And through that, I met Dean Smith and Dr. Martin, and kind of that opened all of these opportunities that I knew that they were involved in. So for some examples of things that are going on at the med school is some of us are involved in some carbon emission quantification of like EMS. There are some student-led projects going on of quantifying also carbon emissions of travel for residency interviews. We just submitted another grant application to try to quantify medical school carbon emissions when we travel for our away rotations and stuff like that. So I think that one of the things I think that we also identified through the Planetary Health Report Card is that there still is a lot of room for growth in terms of research, and luckily our faculty are very, very open to working with us if we have a research idea and helping us kind of get the things together to get that moving. But I think that is something that we really want to push for moving forward.
Yeah, Brown, I think like many institutions, has its silos, so it's hard to connect the different silos. So we have one institute that's based on environmental studies, and there are a lot of basic science faculty or natural science faculty who are housed in that institution. Then we have our School of Public Health, which is another silo, and then we have our medical school, which is another silo, and then we have our clinical faculty, which are like overlapping a little bit with the SPH and the medical school. So one of our goals is to try to take the natural science faculty and team them with some of the public health and clinical faculty so that they can work together on projects.
Yeah, and I think there is like a year-long research grant that our students can apply to, so they can do a year of research in planetary health and be funded for that. So there are lots of initiatives coming up, but I think, yeah, a problem is that because every school is so has their own kind of individual name and branding, it's hard to connect the students and again, there's not a ton of medical faculty who have planetary health expertise, so it is a challenge that we're facing.
One of the things that I think is cool, though, is that there are a lot of student-driven projects. So, for example, we just submitted, like Margaret mentioned, we just submitted a grant to look at the carbon emissions and environmental impact of medical students doing their rotations during their fourth year, to try to get an idea of like how much the impact is when they're traveling to away rotations, sub-Is, and other sorts of other rotations that are really like thought to be integral to getting a residency spot in the specialty that you want. So that was completely student-driven. I think what we're doing is getting the attention of the various institutions too, and that's helping to lead other initiatives on the campus. And we're fortunate enough, I think, that we do have the support of administrators to a large degree. The example that Margaret was talking about is students have the ability to take a gap year. So if you're interested, you can take a gap year either between your pre-clerkship and clerkship years, or you can take a gap year during your clerkship years and spend that entire time working on a planetary health related project. So you can do research, you can work on curriculum development, you can do anything that falls into one of those pillars, whether you want to be focused on planetary health related clinical work, research, education, or service learning. And we have the funding that will support students while they do that gap year. So that was a good thing that we were able to get from our administration through this project. Margaret, let's talk about service learning, kind of transitioning from one pillar to the next pillar. What are some examples of some service learning projects that students have managed to secure through this process of curriculum development through the medical school?
Yeah, so service learning is something that the medical school requires of its students. So basically it's a one-time kind of community service kind of activity that's required as part of our curriculum. And one of the things that I was involved in this year was trying to find ways that students could, be more involved in the community in a planetary health way, because I think it's like this with a lot of universities. There is a divide between the academic institution and the community itself. And so one of the things that we thought was really important, even in terms of environmental health and planetary health and environmental justice, was working with the community to improve the spaces that they live in. And so one of the initiatives that we launched this year was working with a local tree planting organization that plants trees in communities that they identify as being with low tree cover. And so it's actually coming up this weekend. We have a group of, I think, over 20 students have signed up, which is really exciting, to kind of help and plant trees in a neighborhood, and they get to work with the neighbors and the residents to plant trees, which is really exciting and contributes to improving environmental health in our own community. And some other ones that are going on are people are working with some farmers to help them with various projects and needs, and then also working with local tribes, which we have a lot to learn from as well.
Great. And then just one final question for you. What are some resources that are available for our medical students who might be interested in curriculum development, planetary health integration at their own institutions?
So we have are fortunate enough to have an alumni of Brown. Her name is Sarah Sue, who has led a lot of this initiative and that we've kind of been following in her footsteps. And she's a co-founder of a website called Med Students for a Sustainable Future. So it's like MS4SF. And so that's a really nice resource for medical students. And then also there are bigger bigger organizations. Some are more healthcare focused. There's the Healthcare Without Harm, and then there are also various. I think there's like the consortium for curriculum, like planetary health curriculum. That's a really good resource. And so I think for our school, we found it helpful to have we could have a committee called the Environmental Coalition. That's kind of another student-led group that we kind of oversee a lot of these events to help medical students be involved, not just curriculum-wise, but also lifestyle-wise, in how to live and be more knowledgive in various planetary health concepts, whether it be learning to compost or helping them give away like reusable menstrual products and stuff like that. And so that's been stuff that's been going on at the school.
Awesome. Yeah, one other website is the Medical Society Consortium on Climate Change and Health is a good resource for healthcare professionals that are looking to try to integrate some planetary health and climate change and health into their curriculum. Thanks, Margaret. All right, Julia, I have some questions for you. So, Julia, in particular, I wanted to talk to you about one of the courses where we tried to integrate planetary health content into, which is our doctoring course. So our doctoring course is the physical exams course that students have over the course of their first few years of school. So I wanted to ask, why did the group decide that doctoring was one of the courses that we wanted to focus on when we were looking at trying to find courses to integrate curriculum into related to planetary health? Why choose this course as opposed to some of the other courses?
Yeah, so as we've already talked about a little bit, when we were looking to identify courses that would be a good starting point, we looked for really low-hanging fruit, right, which included courses who had faculty leaders who are open to integrating student-led initiatives like this. So the doctoring course was one that we knew the faculty were very open to working with students, and we're actually really excited to integrate new content into the curriculum. The first year medical students, which is the students that received this curriculum this year, had also already received a lecture on planetary health just a month or two prior. And the doctoring course is run in this really nice small group fashion where there are like 8 to 10 students working with 2 faculty members. So we thought this would be a good place for the students to kind of work off of that initial foundation that they got with the introductory lecture, and then talk with faculty about an environmental exposure history, which is the specific skill that we tried to teach them. So yeah, it was really working off of that foundation that they'd already received and then kind of teasing through it in a small group setting.
And when you were putting together this curriculum, what were some of the resources that you used? Were there other sample lesson plans that existed, or how did you decide to go about doing this? Or what resources did you use when crafting this?
Yeah, so I think we've already talked about a couple great resources that are available, but one that we particularly used is from Columbia University, and their university and their medical school and School of Public Health has already done a lot of work in this area. So they have a resource called Climate Resources for Health Education, and it's a free, like research-based, like website that has a bunch of resources, including like sample learning objectives, slide decks, and even faculty guides on how to learn, teach these curriculum. So we use that as a resource.
And then what sort of assessment tools did you use? So as we're going through the process of creating this curriculum and integrating this curriculum, what sort of assessment tools did you use for determining whether the content you created was effective or not?
Our primary assessment tool was in the form of a pre and post survey. This was a web-based survey that was sent out 10 days prior and then immediately after the lesson. And this really had 3 sections. There was a knowledge assessment section with true or false questions. And there was also a section just assessing the students' confidence in this area, seeing how much information they already knew and how confident they felt in taking an exposure history. And then there's also room for feedback because, as we were saying, this was our first time really integrating it into the pre-clerkship curriculum, so we wanted to make sure we had plenty of room for feedback. And then a couple of us actually sat in on the lessons, and Dr. Martin was one of the faculty members leading the small groups, so we got to get like day of immediate feedback from faculty and students.
And two sort of follow-up questions on that. One, talk about the environmental exposure history and why was it important to include that as part of the doctoring course curriculum? And then 2, what was some of the feedback that you got from students and what were some of the observations you had from sitting in the small groups when the material was included?
Yeah, so as we mentioned before, the doctoring course is fundamentally a clinical skills course, so it was important for us to integrate a skill that would fit with the course, so taking an exposure history fit really well. It was also really important for us to give students tools that they can use actively in their future careers, so taking an environmental exposure history is a skill that we thought would be useful, because our goal is to really empower these future physicians to think about planetary health and climate change in their careers. So the role of a physician is to talk to patients, right, and help them better their health. So if you have a patient who you think is being impacted by environmental exposures, it's important to have the tools and know the questions to ask to evaluate that effectively. So some of the feedback that we got from students was actually that they wanted more resources on how to connect their patients to both local and federal resources. For example, if they're having trouble heating their home and then they're using, for example, not to get too specific, but like a stove that's emitting carbon monoxide that could be dangerous to their health, how can we connect them with resources to get them a better way to heat their home? So that was one piece of feedback that we received. And also just they wanted more information. They wanted us to integrate planetary health into the curriculum as we're trying to do. So the students were really invested in this material, as were the faculty members.
Awesome. Thanks. All right, now I have some questions for the panel as a whole. You can just pass the microphone back and forth between each other as you would like. The first question that I have is, if you had an unlimited budget, what are some things that you would want to ask for in regards to building climate change at the institution, building planetary health into the curriculum at Brown and integrating research and service learning?
I want to hear what you guys say.
I think one of the things that we were talking about is just having more of our kind of own institution within the medical school with more staff. Like, I think unlimited money would really help us get the manpower that we want in terms of integrating not just planetary health into our curriculum, but also helping students to fund research and all of that, and community initiatives and all of that. I think as much as it's amazing that it's student-driven, we as medical students obviously all have lots of stuff going on as well, and so it'd be really nice if we had, just a committee at the school their job was to help students and help the school integrate planetary health.
Kind of going along with what Margaret said, Right now at the medical school, we have opportunities for, I guess, like summer research projects, like funding that you can do. What we were able to do so far was create this like year-off opportunity for clerkship students, and that's fully funded. But for a lot of people, it's hard to take a whole year off, and so having something that is specifically planetary health for your summers, I think that would be super useful in getting more students involved, and then hopefully having them continue that sort of work throughout the rest of their time in medical school would be great too.
Julia, anything to add?
I would just echo everything that was said.
So, Brown, like many of your institutions, it is interesting in the following. We have a medical school, we have a school of public health, and we have an institute for environment society. I see those as three siloed units within our institution that have incredible students and expertise that can come together on topics in planetary health. So how do you do that? How do you bring together people who are busy in their own expert fields and silos together? I don't know if it's a center, but I do think it is early on. Things like resources for faculty, student, small teams, and pairs to come together to develop scholarly research and or educational materials in those things. As soon as you can start, I think, bringing people from these different organizations on a campus together to produce work that is useful and successful and really advancing the field, people go, aha, like we actually have everything we need right here to be a leader in this field. And I think Brown has what it takes to do that. How we get there is a question that we're thinking about, but I think you need to provide resources in the short term for teams to come together in meaningful ways to do this kinds of work. So I guess my ask would be pilot money for 5 years to demonstrate what we can do and use that as a way to make a case for something that could look like a center. I don't know.
Yeah, I think one of the things that we're trying to do is, I mean, right now we don't have a ton of money, so we're trying to collect ways that our students are generating research and service learning and the different places where they're presenting at, what conferences they're presenting at, and the different sorts of things that we're doing all together with no money to say, imagine what we could do if we had money. So our hope is that we can, get that full support. We're fortunate enough to be at any university that does have some funds. And it'll definitely be a challenge at schools that don't have that sort of money. And that'll be even more of a push to try to do things from a grassroots level. But my hope is that we can do all of these things going forward, is that we can get the funds that we need to support student-driven projects. I will say one of the things that I think is a weakness of, unfortunately, having it be or it's not unfortunate. I think one of the unfortunate weaknesses of having a student-driven process is that students always move through the system. The students who are leading the process now won't be the students who are leading the process in 4 years. So there's always a transition of students. And that's why I think having faculty involvement is important, because there's less attrition of faculty members or less shift in faculty members as time goes on. But that being said, I do think that one of the strengths of the student-driven approach is that you get fresh ideas every year. So every class of students that's been involved in this thus far has added something to the process. The fourth year group, the group of students that are now in their first year of residency, added something, then the next class added something, then the next class added something. And each group of students has their own sort of direction that they want to take things. And I think that constant creativity adds to the process overall, but the turnover can make it challenging. 2 more questions, and then I want us to just have a discussion where you all can ask any sort of questions that you have, and then we can have like a little conversation about this. So one question is, what is one thing that you wish you would have known before starting this process? What is one thing you wish you would have known before starting the planetary health integration process?
So speaking from the perspective of working on the doctoring curriculum specifically, I think that me and my peer that we worked on the curriculum together is that the students were really invested in the material. I think that at least in our medical school class, there's a great group of students who's invested in planetary health and thinking about the environment. But the impression that we got from the first year medical students is that everyone was really already thinking about this. The majority of the students were invested in climate change and already thinking about the environment. So when we told them that the change in climate was going to impact their patients' health, they were like, yes, of course, we already know this. Now what can we do about it? So we came to them with information and a few resources, some of which we've already talked about. But I think we really needed to come forward with more resources and more action items because the students were already ready to get going. I don't know if other people have things to add.
I guess, yeah, similar, echoing that. I think our class and our generation is really driven and wants to make an impact and help fight climate change. And I think it's been interesting, like a lot of my peers, like they love being outside, they love outdoor activities, but just like the thinking about planetary health aspect within the as a medical professional isn't really there yet. And so I think for me, I think one of the things that I wish I knew was just how big like planetary health is as a concept and how many things that you can integrate planetary health into, whether it be your practice as a physician, the way that you live your life, and all these, and how you do research, like all these things ultimately come down to planetary health. And I think that's just one of the things that I'm trying to tackle is just understanding like how much of an impact it does have.
So I think as we've mentioned previously, one of the challenges that we did face was the fact that the medical school curriculum is already very thorough, and so having ways to connect with faculty and make changes for lectures, that took a lot of time, and it still is taking time. So I think it would have been helpful to know that in advance and sort of get these meetings set up and get faculty on board so that when students had come up with ideas and things that they wanted to do, there wouldn't be so much wait time. We could have something already set up, have a meeting already set up to go to, and I think that would have sped up the process a little bit. So I think over the past few years, it's gotten a little bit easier, but I think for people who are starting to make these changes, that's definitely something to continue thinking about.
Yeah, I think for me, one of the things I wish I would have known is that this was going to take a long time. I think, when the students first pitched this a couple of years ago, I was like, oh yeah, this is going to be quick and easy. We're going to come up with all these courses. We're just going to integrate it into all these classes. Everyone's going to be on board with it. It's not going to take any time at all. And then suddenly it was like, all right, this is going to take like years for us to accomplish everything that we want to do. So I think that's one of the things that I wish I would have known at the beginning of the process that I've learned along the way. One final question, and I want each person to answer this. What's one lesson that you've learned through going through the process of trying to integrate planetary health into the medical school curriculum that you can share with the audience?
Anyone else want to start?
I can offer one. Well, first, I want to thank the students because they teach me things every day, which is wonderful. So I shared at the beginning of this that I'm a disease ecologist by training. I'm not an MD, so I learn all the time from these guys about the medical perspective in this discipline. I think there's a tendency in and around planetary health to focus on climate change as the one environmental change that we need to be most concerned about. And I often find myself offering that we need to pay attention to all the other ones as well, like land use change, the movement of exotic species around the world, pollution, so on and so forth. So, I've learned that, climate change, while deeply and profoundly impactful with depth and breadth, is very important. it gets a lot of attention, and a lot of these other environmental changes don't quite as much, and we can't afford to ignore them when we talk about planetary health. So I'm learning from the ecologist perspective that, well, not everybody's paying as much attention as I am to land use change invasive species. They're really kind of focused on climate. So that's something that's been important for me to recognize, so that I can kind of be the person who's yelling all the time, hold on, there's all these others to think about as well. Yeah.
I think one thing that I've learned and that I am carrying forward is just how much of an impact us as health professionals do have in the area of climate change, or not just climate, sorry, in planetary health, sorry, it was in my head, planetary health. And I think before I came to medical school, I always was interested in the environment and interested in these concepts, but I didn't think that, you know, as a future physician, that I would really get to play a large part in that. And working with all these wonderful people has really shown me that we are in a very privileged position where we have a loud voice, because society gives, you know, physicians a louder voice than a lot of other people. And so I think just acknowledging that and knowing that we do have the power to change the lives of our patients and hopefully the planet as well is something that I'm really, really grateful to have learned.
Yeah, I completely agree with what Margaret just said. I think that the role of a physician as an advocate, and really the responsibility of physicians to advocate for their patients, is one thing that I've learned. Another lesson that I've learned that we've kind of touched on earlier is that I think that, or it's something that I said earlier, is that the younger generation is really on top of climate change and thinking about planetary health and how it impacts human health. And one thing that I've realized is that maybe physicians who've already been in the field for many years and have tried and true practices aren't necessarily thinking about climate change. I think that a lot of them are, but I don't think that as many as we would like are thinking about this. So I think that while we're thinking about educating future physicians and future healthcare providers and future advocates generally, we also need to think about educating the current people in that system to get everybody up to speed and everybody up to on the same page going forward.
One thing that I would say I've learned is that the field of planetary health is really broad. I guess before getting involved in all of this, I sort of saw it as more isolated. But, you know, as you work through this, you realize that there are experts in every field. There's physicians in every field that can incorporate planetary health into their practices. And so that made it almost more tangible to create change. I think before I was sort of like, okay, I don't know how we're going to accomplish all this, how we're going to get all these people interested in this area when it doesn't like directly relate. And I did more research and learned more, and I feel like I've realized that it is part of every field, and every physician or, you know, anyone in general can really benefit from incorporating that into their lives and into their practices. And so that made me more confident in creating a lot, or being a part of a lot of the initiatives that we have at the medical school, and getting some support from people in various areas in the medical school and the public health school in general.
Awesome. Well, thank you everybody for your participation on the panel. Now I just wanted to open it up to anyone in the audience who had any sort of questions for people who are on the panel, or anything that, you know, we can answer or work together on.
Or if you have advice.
Yeah.
I guess one comment. So I'm in the U of C Department of Family Medicine, and we have workshops. So it's not in place, but we have workshops with our preceptors, and family medicine is a kind of a 40 to 50% of the docs in Canada to have it grounded. So lots of residency spots, huge residency programs, etc. So we reached all our teachers, and they expressed such a strong, like they had eco-anxiety, as we all knew they would. But then they felt very much knowledgeless, like they didn't, although we're trusted very much in society. So I think that was just a that was, we knew they'd feel that way, but we didn't know how strong. So now that we've tapped into it, I think giving them time to voice that before we educate them and get them all up to speed will be super important. But I would love to ask you guys, because I think you're at a very similar stage, or maybe probably more advanced than we are in Calgary, or we're more siloed. It's weird, but we have this One Health group at campus that we're trying to access to sort of leverage, because right now they don't really deal with medicine. But my big question is, so the deeper you get into this, that you realize kind of the issues around equity and vulnerability being huge. So how do you, as Brown University, and how do I at U of C with a board that's mainly funded or supported for many years by oil and gas, how do we deal with some of these things that make it a very inequitable world that we're in? So do we, I don't know, if you thought big picture, like do you partner with some of the state universities that are trying to teach med schools to try to raise equity? Because what we do in our silo of kind of wealth, does it make a difference in the end? So big question.
I'm leaving it to the panel.
I'll offer one. So, we, at our medical school, we've long had 3 pillars: education and research and clinical enterprise. We've added community engagement as a new pillar of the medical school, and the students can talk more about that and their feelings towards it. But I think for us, that's going to be one place where we can start to address some of the topics that you're pointing to. How do we not just give back to and bring to a community, but genuinely, truly partner with them in a way that's meaningful, and not in a way that we're acting like colonialists, going in saying, we think you should, but going in and listening and saying, what are your challenges and how might we help you? What do you need? And then let's bring that to them. So I think when we talk about planetary health, I expect that that's one place that we'll start to see the attention to the kinds of populations that you're talking about. So it's one that I can think of. Do you guys have others? Sure.
I think, like I mentioned in one of my previous answers, there is always, especially with our private universities, between our university's land and the community, there's this wealth injustice. And as you go further from the university, it becomes much more obvious. And something that I've been working on with some of my peers is working with a community organization. And the thing that I found that was really interesting, that although the organization calls itself a tree planting organization, they really are interested in improving community health. They've wanted for years to work with doctors, and they were so eager to work with us because they were so excited to finally have grasp on the healthcare system, because the land around the hospital isn't very well kept. The hospital isn't a great, our hospital systems, they've reported, aren't great stewards of their land. And so I think just hearing from the community organization what their needs are and what their goals was really enlightening for us, because then we're like, okay, we can partner with you, not in a, patronizing way, but rather as a partnership. And that's something that we're working on long term.
Yeah, I mean, Julia, I'm going to put you on the spot, but do you want to talk a little bit about the program that we have with Deep Scores, where we're working with the high school students?
Yeah, so Deep Scores is a program that we have where we're working with other Brown University faculty outside of the medical school to partner with the Providence Public Schools and develop a planetary health curriculum. So that's going to include themes about the environment and the planet generally, and just planetary science as you learn in high school. Also talking about climate change, and then taking the next step and being like, okay, well, how is climate change going to impact our community, and how is it going to impact our health? And I think by building that partnership with Providence Public Schools, we're trying to reach, as we were saying before, the community outside of Brown and outside of the medical school, and really connect with people who are experiencing the effects of the environment that we talk about. And I think that empowering them to think about that as well is really important. So yeah, building that community engagement. And I think that this theme of environmental justice is central to planetary health. You cannot have planetary health without thinking about the justice and the disparities and effects that people are going to experience. I think that's a great point.
Yeah, I think that's one of the main ways that we're really trying to focus on bringing what we have in the medical school to the community. And this, like Julia was saying, this involves us going to Hope High School, which is one of our local high schools, and working directly with students, demonstrating, like through various like participatory experiments, like what are temperature differences in, you know, in green spaces and non-green spaces, and how are there examples of, you know, in the United States, there's a lot of structural violence that leads to environmental justice issues. So translating, you know, some of the earth science and combining that with environmental justice, and then empowering at the same time. So giving students the opportunities to be involved in advocating for change in their communities and creating that change. From a university level, though, I think, you know, that's a good challenge, I think, for us to think about partnering with some of our state institutions. So in Rhode Island, you know, we have University of Rhode Island, you know, that might not have the same sort of resources of a Brown University. And maybe that's something in the future, you know, if we get our 5-year plan, we can start branching out and reaching out to some of the schools that might not have that same sort of funding. Because I think that is an issue. You know, your Browns, your Columbias, your Harvards, your UCSFs, they have money. And, you know, how can you share the wealth, so to speak, is a challenge.
Yeah, I have just something to add as well. I think something that would also be helpful is just getting involved in policy. I think that there are, so for example, there are bills that we can lobby for as students, and we're able to speak, you know, to different representatives about these things. So for example, I was a part of a project that was lobbying for a bill on different recycling receptacles across the state, as well as like, you know, how to manage waste at various institutions. And so there are bills that come forth, and actually, you know, this was my first time like lobbying for something like this. I found that medical students and physicians lobbying for policies like this is actually, it's a big deal, and it plays a huge role. And so I think getting students involved in more policy initiatives like that could also help statewide.
Awesome. All right, any other questions? We've got time, I think, for one more.
Yeah, I have some question for like the inclusiveness of this curriculum in the medical faculty, because I meant what you mentioned that is some elective courses. So how do you ensure that all students will take the same message, or the medical students will actually take these courses? This is one thing, because if it is elective. The second thing is, what about the people in the specialty? For example, this is what, through my last work, I found this is very tough thing, because it's easier to incorporate in the medical curriculum for the students. But what about the specialty for cardiology, anesthesiology, or different specialty, urology, and what about them? For example, these students, I understand that they will be the future doctors, but who are already practicing the general physician or the specialty field. Is there any initiative from Brown, like the doctors from Brown, they will some the leaders of this field at the clinical setting? Is there anything ongoing, or is there any linkage between this initiative in education for the kids, for the medical students, and the clinicians already established?
Yeah, I think that we didn't talk much about it, but there is a dual initiative for faculty development, where we can reach out to some of the faculty who are, you know, clinical and non-clinical at the medical school. So I did faculty development for a group of physicians that are a part of the doctoring course as part of their orientation to the new curriculum that we were including. And I think that our hope is that we can continue to develop modules for the various specialties, and that would be something that, you know, Dean Smith and I would work on, in addition to some of the other faculty that we have, or not faculty per se, but physician staff that we, or physicians that we have in Rhode Island, the Rhode Island Medical Society is our big statewide group of physicians, and they're physicians of all sorts of different specialties. And we have a climate change and health committee that's a part of RIMS, and they work on things like Kanika was talking about with advocacy for bills and testifying in support of bills that are in the state legislature. But they also have the ability to put together some of this faculty development material based on the different specialties. So, for example, like there is a family medicine physician who works a lot with adolescents and adolescent health, who is putting together a module on climate anxiety, and we have dermatologists who can work on putting together material for faculty that's related to, you know, planetary health and derm. So we are moving in that direction as well. Again, I think from the student perspective, we talked about how it's a slow-moving process in a lot of ways. In faculty development, it's the same sort of thing. It's building momentum, but it's certainly not at the place where we want it to be at this point.
Yeah, so regarding the elective courses, so that is, I am not so much aware of the system in Brown. So elective means not every student is like they are not bound to take the courses, something like that.
Electives they get to choose.
Yeah, so
sorry.
choose.
Electives they choose.
What is your experience that what percentage of the students take these courses?
Well, so our aim, and sorry if we weren't clear, is for every single course and block throughout the medical school to have a planetary health module built into it over time. So you can't escape it.
Okay.
Yeah.
You can't get through without it hitting you
Yeah.
multiple times. Right now we have some electives, and those students get to choose, but we aspire to do so much more than that, really, right? Like you can't get through without
but what
it hitting
is the
you.
trend you see, that how many students are motivated, or what percentage of the students take these courses?
Well, if
Just
we
an
were,
idea.
well, so we don't have it built into the curriculum yet, but I would say
Oh, okay.
between the members of our curriculum integration committee, students last year and this year who are in the electives, and then students that you're working on, I think we've got a group of maybe 20, 30 people
20 or 30
who are
students.
engaging with it so far in different ways. We have given a guest lecture to the very intro class, right? Like the intro course for the current class. I think immediately after that, about 100 and something students in the room?
140 or something.
140. You know, there were many questions afterwards, lots of emails, how do I get involved? So I think the interest is there, yeah.
Yeah.
And many countries like in UK, in Norway, like where I work, University of Oslo, they have established a Center for Sustainable Healthcare Education, SAC. So I think these type of centers are being developed in Europe and US
Yeah.
in many places. And they actually work on this planetary health curriculum, and that is very effective, I think. A definitive center for this curriculum development that would help. That means that would help you and everyone.
And I think
on perspective.
I think that's what we're working towards, is that creation of that center, whether that center be, you know, located within the medical school itself or located somewhere else in the university, connecting the different branches that we talked about, like the medical school, the School of Public Health, and the Institute for Environmental Studies. So I think that's the direction that we're headed towards. I think that it's all about timing, and I think we're approaching probably a good time for that sort of thing to happen. But I think that it's inevitable. It just is a matter of when it happens. Yeah, go ahead, Margaret.
So going back to your question about the oil and gas, it had me thinking with what Julia was talking about with the environmental history. I think a lot of the population who are affected negatively by environmental exposures are those who work in industries such as oil and gas, who work in mining. And so I think something that we strive to work towards as well is identifying these vulnerable populations and trying our best to make sure that we give them the resources that they need. And so I think that is something that also goes into faculty development, how as physicians we can better be equipped to take care of these patients, because if that's their livelihood and that's how they're making a living, like we can't necessarily change that, but we can make sure that we do our best to, you know, mitigate the effects of the environmental hazards that they're being exposed to.
Great. Well, thanks, everybody. We really appreciate you coming and participating. And, please feel free to ask anyone any additional questions you have, and we're happy to reach out with any resources to connect. Thank you.